Hi, I'm Dr. Cheng-Yi Huang. I'm a psychiatrist at the Body Psychiatry Center in New Taipei City, Taiwan. It is my pleasure to be here to share insights from our paper published in the Journal of Clinical Psychiatry entitled Long-Term Outcome of Early Use of Long-Acting Injectable Antipsychotics in Schizophrenia with you. This study was conducted by Dr. Su-Chen Fang, Dr. Yu-Hsuan Joni Shao, and myself. Patients with schizophrenia usually have poor treatment outcome and shorter lifespan by 10 to 25 years compared to those of the general population. Although long-acting injectable antipsychotics, LAIs, could improve treatment adherence, thereby reducing relapse, rehospitalization, and even mortality. In clinical practice, LAIs are still not widely used, and physicians tend to use them only after multiple adverse outcomes, such as multiple relapse took place. According to a research of trial review, after initiation of an oral antipsychotic regimen, it takes on average 7 to 8 years until patients begin their first LAI treatment. Our study investigated whether patients with schizophrenia that require psychiatric hospitalization due to their severity would benefit from the early initiation of LAI treatment. We thought it was important to provide more insights about the impact of early use of LAIs on the disease trajectory, because only a few studies compare the long-term outcome between patients who switch to LAIs and those who remain on an oral antipsychotics, OAPS. We used the Taiwan National Health Insurance Research Database to construct a cohort of 19,813 newly diagnosed schizophrenia patients hospitalized from year 2002 to 2005. Within this cohort, 678 patients who switched to LAIs during their hospitalization were identified. The LAI group was matched to another 678 patients who remain on OAPS. The LAI group was further divided into patients who switched to LAIs within 3 years of OAP initiation, which is considered an early stage group, and those who switch after 3 years is considered the later stage group. Conditional task regression and conditional negative binomial regression were used to estimate the risk of death and the number of hospital visits between these two groups. Our results showed that during the 13-year study period, 312 patients switched to LAIs within the first 3 years of OAP initiation. The all and the natural cause mortality in these patients were much lower than those who remain on OAPS. The hazard ratio for all and the natural cause mortality were 0.49 and 0.30 respectively. Patients who initiate LAIs during the early stage of schizophrenia had a marked decrease of risk of rehospitalization, psychiatric hospitalization, and psychiatric ER visit compared to patients who remain on OAPS. However, the protective effect of LAIs on relapse or mortality were not further observed in patients who initiate LAI treatment during later stage. In summary, using LAIs in the early stage of schizophrenia profoundly decreased the risk of relapse and mortality among severe schizophrenia patients. Beyond the early stage, the protective effect diminished. Therefore, more proactive consideration of LAIs as a treatment option in the early stage should be encouraged especially for those require hospitalizations. We would like to invite you to visit the JCP website for the full text and more details on our study design and finding. Thank you very much.